Hey guys, let's look at another disease in children known as acute rheumatic fever. So, what's acute rheumatic fever? Acute rheumatic fever is an inflammatory disease that can develop as a complication of untreated or poorly treated throat infection caused by group A beta hemolytic streptococcus, the bacteria responsible for strep throat or scarlet fever. What causes it? It is caused by an autoimmune reaction after streptococcal infection. The body's immune system mistakenly attacks its own tissue, like the heart, the joints, the skin, the brain, after fighting the bacteria. So, in acute rheumatic fever, poorly or untreated streptococcal infection, especially by the A type beta hemolytic streptococci, what happens is that the body mounts an immune response against the organism. This immune response now become uncontrolled, resulting into it attacking the body's own tissues such as the skin and joints, resulting into rheumatic fever. So, who's at risk? Mostly children aged 5 to 15 years, people in areas with overcrowding or limited access to medical care, that's socioeconomic status, poor socioeconomic status. So, what are the major symptoms? Jones criteria encompasses the major manifestations, which are carditis, that's inflammation of the heart, polyarthritis, painful migrating joint swelling, chorea, involuntary jerky movements, that's Sydenham's chorea to be specific, or St. Vitus's dance, erythema marginatum, rash with ring-like edges. We have subcutaneous nodules, painless lumps under the skin. You can see one here. So, what are the minor symptoms? The minor symptoms are fever, joint pains, raised erythrocyte sedimentation rate, C-reactive protein. They are actually the inflammation markers. So, how can you remember the major criteria? To remember the major criteria, you consider Jones. J for joints, that's migratory polyarthritis. O, you think about the heart shaped like an O, that's carditis. N for nodules, that's subcutaneous nodules. E for erythema marginatum, that's ring-like rash. S for Sydenham's chorea, involuntary jerky movements, also known as St. Vitus's dance. So how can you remember the minor criteria? You think about FAP. F is for fever, A for arthralgia, P for prolonged PR on ECG, or raised erythrocyte sedimentation rate, or C-reactive protein. How to remember: you picture a Jones running with sore joints, holding his heart, covered in erythema rash with nodules on his elbow and shaking. That's Sydenham's chorea. What are the laboratory features? We expect to see polymorphonuclear leukocytosis, raised erythrocyte sedimentation rate, positive C-reactive protein, prolongation of the PR interval on ECG, elevated antibody titers to streptococcal antigens. Group A streptococcal organism may be cultured. So, what are the complications of rheumatic fever? We have rheumatic heart disease, which is permanent damage to heart valves, especially mitral valve, heart failure or arrhythmias in severe cases. So, how do you make diagnosis? Based on Jones criteria, you combine the major plus the minor features plus evidence of recent streptococcal infection via throat swab or ASO titer. Blood test shows inflammation. So, how do you treat? First, you eradicate streptococcal infection. Penicillin is actually the first line. You control inflammation, aspirin or corticosteroids for joint stroke heart inflammation. You treat heart failure if present. You do long-term prophylaxis, monthly penicillin injections to prevent reoccurrence. So how do you prevent rheumatic fever? You prevent rheumatic fever by early treatment of strep throat with antibiotics. You do long-term prophylaxis for those who have had rheumatic fever to prevent relapse. Thanks for listening.